Yep.
Think we do?
Oh.
Okay. All right, so we're going to get rolling. So I want to welcome everybody to the Alyssa's Place and GCAT 2020 Gardner Mayoral Race Virtual Candidates Night. Thank you for tuning in. Some of you are signed in through the Zoom, and others are watching us on live stream on Facebook. Again, thank you for taking the time. We had originally had all 4 candidates who had agreed to join us tonight, and we appreciate that. Unfortunately, Christine Johnson let us know that an event, something came up for her, so she can't join us tonight, but she's here in spirit. And before we get rolling, I just want to take a minute to thank all the candidates who are willing to throw their hat in the ring and be a part of public service. It takes a lot to do that. And, you know, we're really gracious and appreciative of your willingness to serve your community. Tonight's night is a little bit different in that it's not for the community at large per se. We wanted to have an event specifically for the recovery community. It's an issue that's near and dear to my heart. Like I said, my name is Sean Hayden. I'm the Chief Operating Officer for Gaamha here in Gardner, and we're a provider of substance use disorder services, and we have a number of programs throughout the region. And I'm a person in long-term recovery. So this is an issue that's very important to me and for a lot of people I work every day for. The questions tonight, the topics are going to be around substance use and prevention and harm reduction and recovery and treatment. And we're really appreciative of all the candidates who agreed to join us. The format tonight is that we're going to give every panelist a couple of minutes to have an opening statement, 2 minutes, and then we're going to go into a series of questions on those 4 topics I mentioned: prevention, harm reduction, treatment, and recovery. And every panelist will have about 2 minutes to answer each question. If we get near the end of your 2 minutes, Alexa's going to hold up a sign. There's Alexa. She's our program director at Alyssa's Place. She's going to hold up a sign and give you a 30-second warning. So we're going to do our best, and what we'll do is we'll kind of mute people so that there's no crosstalk and interruption, that sort of thing. This is not meant to be a debate. This is an opportunity to get to know you folks and hear your thoughts on the things that are concerned to us. And there might be some people thinking, well, why would we have an event just for the recovery community? And what I would say to that is SAMHSA estimates almost 10% of the population of the United States would qualify as having a substance use disorder. So if we look at the city of Gardner with about 20,000 people in it, that means about 2,000 people in our community may have some kind of issue related to substance use. And each one of those people has parents and loved ones that are concerned about them as well. So this issue is pervasive. It's in every household and touches the entire community. So we think it's enough of an issue that the things we're concerned about deserve a little bit of attention. So again, thank you everyone. Again, this is brought to you by Alyssa's Place, Peer Recovery and Resource Center, and by the Gardner Community Action Team. I mentioned Alexa. We also have Veronica Patty, the coordinator for GCAT, and Michelle Dunn from the AED Foundation and Gaamha here to help us kind of produce things behind the scenes. And if anyone who's watching has a question, please use the Q&A function at the bottom of your screen to submit a question, and we'll do our best to get those in. We have some pre-submitted questions from folks who sent those in over the last week, and we'll get to those too. So without further ado, I've said about enough. We went through a very scientific method of picking the order of who would get to speak tonight. I put name tags under treats and let my dog loose, and he picked who was going to go first. So what we're going to do is, in order tonight, Mr. Cordero is going to go first, followed by Mr. Graves, and then Mr. Nicholson, and then we'll just snake our way back and forth through the order. So with that said, this is we're going to give you a couple of minutes each, starting with Scott Cordero, to kind of introduce yourself to the community and say what you will about why you should be elected mayor of the city of Gardner.
How is everybody doing tonight? Hope everybody's well. A lot of crazy things none of us have ever been through before. But I moved to Gardner 26 years ago, and this is near and dear to my heart. I've been in recovery for almost 26 years now. This summer will be 26 years. And I came here through the Pathway Association. So this is very important to me. There's a lot of people that are dying out there that just don't know that there's plenty of help out there. There's more needed every single day. But I decided to run for the mayor of Gardner because this town has been very instrumental to my recovery. It took me into as their own family, and it's been very great to me. As time has gone on, I've seen a lot of people in recovery that die due to health concerns or due to addiction. And I think there's a lot more that we can do. And I think we can't do it alone. We need each other's help, and that's just also in life. But because this town's been near and dear to me, and I've seen it go down, especially in businesses over the years, I felt like I needed to give back what's given to me. And that's kind of why I chose to throw my hat in the mayoral race and see what I can do with the help of everybody to put our heads together and come back to a great town like we once had. And that's really all I have right now.
Sean, you're muted.
Yeah, we'll get good at this by the end of the night, I promise. Scott, thank you very much. And next we want to hear from Scott Graves.
Hi, everybody. My name is Scott J. Graves. There's another Scott Graves in the city, and he has a middle initial of M, who I know Scott as well, and he's a really good guy. Anyways, I'm Scott J. Graves. I was born and raised in Gardner. I was born in 1964 at Hayward Hospital, and graduated from Gardner High School in 1982. Lived here my whole life. I've been a city councilor for quite a while. I was city solicitor for 4 years. So I've been involved in Gardner politics for a long time. I've seen a lot. I know a lot. I have a lot of experience. Some people might think that's a bad thing. I think it's a good thing. I wanted to, at the time that Mayor Hawk took on his new job and I call it quit, but when he announced that he was going to take the new job, I was city council president. So at the time, it seemed to me that it would be a smooth and seamless transition for me to throw my hat in the ring and probably be acting mayor, and then just keep on with that term. But politics reared its ugly head, and I was demoted, and so here I am as just a lowly city councilor. I have a lot of plans for the city. I love the city. I'm not a partisan. I'm very neutral. I don't belong to a political party. As a matter of fact, I think political parties are not a good thing. I don't play backdoor politics. I don't favor people. I don't ask for gifts. I don't give gifts. The only thing I care about is the citizens of Gardner. So that's why I'm running. So that's it in a nutshell. Thank you.
Thank you, Scott. We appreciate that. And now we're going to turn to Mike Nicholson. Go ahead, Mike.
Good evening, everyone, and thank you, Sean, for putting this on. My name is Mike Nicholson, and as was said earlier, I'm one of the candidates running to be the next mayor in the city of Gardner. I grew up here in Gardner, born and raised, and then after graduating from Gardner High School, I went to the University of Massachusetts at Amherst, where I got 2 bachelor's degrees, one in history and one in political science, and then after that got a master's degree from the UMass School of Public Policy and Public Administration. Currently, I work as the town administrator for the town of Rutland. If you don't know what that role is, it's the town's equivalent of a mayoral position. I run the day-to-day operations of the town as the town's CEO, and track its finances, its budgets, its operations, and so on from there. And prior to that role, I worked as Mayor Hawk's executive aide, which is the position that works closely with the mayor on every project that they have going on. One of the reasons I wanted to run is being someone who works as a municipal executive somewhere else. You get a lot of sense of pride for the work and the difference you can see in the communities that you're working in. And being able to do something like that in my hometown that made me who I am today is something very special that I feel every person should find a way to give back to their community. So this is one way that I'd like to throw my name in the ring to help give back to the place that made me who I am. Before we begin, I would like to say that Gardner should really be proud of the work that it is doing in its prevention efforts with our Board of Health, our police department, and so many other community partners who help us with this struggle day in and day out. And I look forward to be able to sharing those ideas with you all this evening. Thank you very much.
Thank you, Mike. Alexa, who's going to get question number 1? You have the order there, right? Are we going to go?
All right. So Mr. Graves gets question number 1.
Okay. So Scott, so the first category we're going to go into, and let me unmute him. The first category we're going to go into is the topic of prevention. So the question is, in your opinion, what do you think the city's role is in the prevention of underage substance use? And do you have any ideas of what that would look like if you were to be elected mayor?
Thank you. Well, let me just start out by saying I'm no expert in this field at all. I would dare say that I'm ignorant in this field. I know a little bit. I mean, I'm one of the lucky ones that I haven't had anybody near and dear to me that's been affected by it except myself. But yeah, I've really been untouched by it. But as everything else in the city and everywhere, it starts with education, and it should start at home and at school with young people. And I think the country and the city has done a good job in the last few years. I mean, in talking about it. I was around when it first started. I mean, when pain medications started getting passed out like candy in the 90s, you know, I was just out of high school, I was in college, and people weren't talking about it. People were getting addicted and nobody was talking about it. So I think education is the way to go at this point. And then we have great organizations like Gaamha and Alyssa's Place, and that helps bring it to the forefront so that people are not, I don't know if you want to call it stigma or embarrassed. People can talk about it now. And I think kids, you know, say you're 15 years old and you're playing football and you get hurt and you get the pain medication and you can't get off it. I think that kid is more apt now to talk about it, whereas before you might just not say anything. So I think education's the key to that. And if I am mayor, I'm going to make sure that there's a line between City Hall and organizations like yours, so that we can keep the city more involved, as involved as we can be. Thank you.
Great. Thank you. All right. And next, it's going to be the same question to Mike Nicholson. Mike, what do you think the city's role is in the prevention of underage substance use? And do you have any ideas what it would look like if you were elected mayor?
Thank you very much. I agree with Councilor Graves. I think the fundamental part of prevention for our youth is education. We do a lot of good right now with trying to reach out to our students, particularly with the existing program we have now with our police department called the Handle with Care program, where if the police department responds to a call where they note that a student had a incident at home or is having some hard times at home, the police department confidentially lets their guidance counselor know, who lets the teachers know, you might want to take it easy on this student there. And then it facilitates a discussion with the guidance counselors. But there's still more we can do. One of the ideas that I would have if elected mayor is something similar to what Fitchburg has, where they have a city staff person who's a prevention coordinator for the city. I took a look at the draft of the city's budget for FY21 this past week, and I think that this is something that we would be able to look at, is hiring someone in our Board of Health staff who can, either a major part or all of their job purposes be to run education programs for both our students and just for the community at large, to help make sure that our prevention efforts are strong and getting the effect that they're supposed to be happening. I will say too, having one of our lieutenants on the leadership team for GCAT, having our police chief on the board of directors for the AED Foundation, our board of health director is the former Massachusetts Opioid Abuse Prevention Collaboration Coordinator for the region. I think the city already has a lot of the policymakers in place to start making a difference, and that new position would just create even greater of an effect to make sure that the connection is there. Thank you.
Great. Thanks a lot, Mike. And Scott, same question to you. What do you think the city's role is in prevention, and what would that look like if you were to be elected mayor?
Well, I'd like to go back to my high school days, if you may. You know, there was a lot of people doing a lot of different drugs when I was in high school. And it seemed like there was more people doing drugs than not, to be honest with you. And it wasn't really talked about as like a bad thing because so many people were doing it. But as time went on, you understood that it was bad because people were getting hurt or dropping out of school or this and that. And so I think that, in my own recovery, I needed to talk to people that were in recovery about it, and I think that in order to talk to somebody that's addicted or, in substance abuse, whatever that may be, you have to kind of understand the shoes they walk down and the roads that they walk down. It's not something you learn out of a book. You may understand and you may feel bad for them, but you truly don't understand because you never walked in those shoes. And that goes with a lot of things. So I think that in order to help others, and I think people in recovery resources like yourself, Sean, that, you can relate to them. So I think we need people that can relate to the ones that are suffering in the substance abuse in order to go out there and talk to them. Chris Herring goes out and talks to people in schools and stuff, and people can relate to him because he's walked in those shoes, and it's a great program that Chris is doing, but I think that, people in recovery can give back getting into schools and talk to them on their own level. And I think that that's where we need to start. Thank you.
Great. Thanks, Scott. So we go into our next question, and I think it's going to go right back to Scott Cordero. Is that right, Alexa? Okay. All right. So the next question, and we heard a little bit about this in the previous question, is Scott, are you familiar with the work being done by GCAT, the Gardner Community Action Team? And if you were to be elected, would your office have a presence? Would the city have a presence on GCAT and support their ongoing efforts in that coalition?
I can't say I'm totally familiar with everything. I was involved for a little while, and I started my own recovery program with one of my friends. But I think that a liaison is definitely, if not one already, that we definitely should have one with the City Hall in any kind of program that is dealing with recovery issues. I think the more, the better. But again, I do think there has to be somebody in recovery that is a good liaison that's also connected to the outside community. Especially we have Recovery Centers of America, which is a couple minutes away. That's a true blessing in our area. They just start accepting Mass Health also. So that's also a great help. But GCAT has done great things. They have their program in the summer, the speaker, and there's a lot of organizations that come there. I think we need more of that in the recovery community. And this community is very strong recovery based. I know for sure, because I'm one of them. Thank you.
Great, thanks. And then we'll rotate to Councilor Graves. Same question, are you familiar with the work that GCAT does? And would your office or the city have a presence on GCAT and support the coalition going forward?
Yeah, I'm not ultra familiar with it, a little bit. I'm a little familiar with Luck through my other job as a lawyer. And I know about GCAT. Again, I haven't had the intimate involvement with having somebody in my family or a loved one have the problem. But I would say that, I had a problem myself, but I was one of these humans on this planet that was able to take care of it on his own. And I know that not too many people can do that. As mayor, I plan on the position that Mr. Nicholson had, the executive aide. I plan on putting that position back. I think that's an important position, and that position would be the linchpin position with GCAT. I would make that a priority, a number one priority with that position. I think probably Mr. Nicholson would agree. He can speak for himself because he goes next. He knows a lot about that position, and he knows a lot of good can be done from that position. And again, not to sound like a broken record, but GCAT would be top on my priority list because and underage drinking for me is near and dear to my heart. When I was growing up in Gardner, everybody drank. Everybody drank. When we had a party, everybody was drinking, and you didn't go to a party unless you were drinking. I mean, if somebody said we're going to go to a party and we're going to drink iced tea, I wasn't going. None of my friends were going. So that's near and dear to my heart. That would be right in my office with the executive aide. Thank you.
Great. Thank you very much, Scott. And Mike, same question to you. Thoughts about the work being done by GCAT? If you were elected, would your office or the city have a presence on and continue to support the efforts of that coalition?
Thank you. Yes, I am very familiar with the work that GCAT is doing because of my time when I was serving as Mayor Hawk's executive aide. I think a lot of the work that they do with our schools, particularly when we had the SAD program running in the high school as a way to help educate our students at the high school, a lot of the different other programs that they do through the National Night Out, their monthly meetings, and their different community events to help get their programming out there. I do think it's, the city, as I said earlier, is already in a strong spot where just on the leadership team of GCAT, we have the police presence through Lieutenant Maroney. We have our Board of Health Director who serves on the leadership team. I think if I was to add that position, if elected, that I mentioned earlier, I would like them to be very involved with GCAT too, because that's how you get the effectiveness. No one works in a silo together. It's when you work together that you really get the effect you're looking for. And Councilor Graves is right. If elected, I would bring back the executive aide position and make sure that they are working with either the prevention coordinator that I mentioned before and with GCAT to make sure that we are getting the greatest impact from the work that they're doing. There's a lot of good already being done. And once you get everyone together working on the same page through the administration, the private sector, our businesses, and our residents, and those struggling with addiction, it's amazing the work you can get done and the impact you can make.
Great, thank you. All right, so we're going to move into our harm reduction questions for the night, and we're just about right on time, so we're doing pretty well here. Alexa, help me out. Who's going to get this question first? Are we going to Councilor Graves? Mike? Couldn't hear you.
Sorry. We are going to Mr. Graves, yes.
Okay, all right, thanks. All right, so harm reduction. So this was a community supported submitted question. This question comes from Speaking of Coalitions, comes from Chelsea Patrice, the Chinna 9. And her question is, everyone likes to support folks who are in recovery, especially long-term recovery, and prevention feels good. We're keeping kids from going down the wrong path. The hard part is the in-between, which is harm reduction. Can you talk about what you believe are opportunities for Gardner to support people and their families who are in active addiction, who may have some failed attempts at recovery? These are the people who often struggle with mental health, housing, employment, the criminal justice system, histories of trauma and abuse. What are programs you'd like to see implemented or relationships you would like to build to support these members of the community? So we're talking more about people who are still active in their drinking or their drug use, and they're here in the community no matter what. So how can we support those people?
Well, I think I'd probably win the Nobel Prize if I could come up with the answer to that one. Let me just say that the city of Gardner, we're going to level fund our budget again this year. We literally have very little money for extra things. But the first thing I thought of, but there is always some money to do things. But we have, like, the first thing I thought of when I heard that question was Alyssa's Place. I mean, these peer review, peer recovery organizations like Alyssa's Place, as far as I understand it, that's what these organizations are for people who went through it, sort of what Mr. Cordero was talking about. You have to walk in those shoes before you can actually help somebody. And so I think organizations like Alyssa's Place, again, I would make that connection from my office to Alyssa's Place, Gaamha, organizations like that, GCAT, so that people that are still struggling, I mean, it's one thing to quit, or it's one thing to get sober, or it's one thing to recover, but you got to stay that way. And I think most people can't do it the first time, so they need that assistance. So that's very important. I mean, you just can't get somebody out of a recovery center and then they just walk out and their life's going to be normal again. It's not going to happen. So the city, if I'm there, is going to be interested in making that connection from one side to the other.
Great.
Thank you.
Thank you very much. So we'll go to Mike Nicholson. Mike, same question to you. How do you see the city helping people who are still active and maybe still struggling, with the substance use disorder?
I think one of the main things we do is currently that we can continue to work on and strengthen is we already have a very strong connection with AIDS Project Worcester, who comes out and does our Narcan classes and helps distribute Narcan throughout the community. This is just one way to help save lives for those who are currently in their struggle. I think there's also some other things that we help work on to help improve here. The city of Gloucester has what's called the Angels Initiative, where if someone is currently struggling, but they want to make that step and they're having a hard time and they go to the police station, they can meet with an officer confidentially. No charges will be filed, no arrest will be made, but they just let them know they need help. And then they're provided with a angel who then keeps track of them. And it's someone who just keep that open communication going. We have agencies like Gaamha and Alyssa's Place, Peer Recovery Center here in town that we could piggyback off of that model and try to see if we can set something up here, since we already have the connection between our police department, our city, and AED. I can say that harm prevention is something that I'm not even close to an expert on, and it is something that I need to learn about too. I do know that every June there is a harm prevention conference nationwide to talk about what other cities and towns are doing. So, I mean, if I'm elected, one of the things that I would like to do is that next June, either myself or someone from my administration, if elected, would go to that conference to see what we as a city could be doing to boost our harm prevention efforts in the city to, again, make sure that we are really helping those who are struggling. We currently do what's called the POST program, post-overdose support team, so that if an officer does respond to an overdose call, they then follow up with a counselor to make sure that the person who had that overdose is doing okay afterwards and is finding the help they need. What I would be concerned is with the current pandemic situation, while we've actually seen a decline in the number of overdoses that our first responders are going towards as this draws out, is that going to be a factor in the overdoses we respond to? So that's something that I would like to see the next mayor work towards if this pandemic draws out, that we start meeting those needs now. Thank you.
Great, thanks. And Mr. Cordero, same question to you about, what could the city do in regards to harm reduction for people who are still struggling?
If elected mayor, I'd like to put together some type of volunteer staff, like Alyssa's Place does, where people in recovery would reach out to these people. I can tell you from my own experience that, and as much as I'm friendly with a lot of policemen in town, that the last person I would probably talk to when I was still using was a cop. But I'm saying that they're not trying to do their best, because they are. But I think when you are in an active addiction, you really need to speak to somebody that is in recovery, because they feel more comfortable. They feel that they're understood, that they're on the same playing field. I can talk to my own recovery. I was in when I was in detox, and the person told me that they weren't in the program, that they only learned about it through a book. I had nothing more to say to them at that point, and it's not because people aren't trying to give back, or trying to help me. I just wanted somebody on my own playing field that really understood me, to walk in my shoes. So I think that it's important to have a volunteer staff out there that can reach out to people in recovery, especially the ones that are still active, and I think that if we did that way, people will feel like they're not a bad person, because they're not bad people. There's a lot of people I know in long-term recovery, even short-term recovery, that are brilliant people that can do amazing things. And I can tell you this, that I would not be where I am without, the Gaamha program supporting Pathway and the people in this community. There's a lot of people in recovery in this community that can really help. And they do already on a daily basis. The AA program, the NA program is tremendously strong in this town. We're very, very lucky to have that. Thank you.
Thank you, Scott. We have another question in this same category, and we're going to go to Mike Nicholson on this one. So it's not always that pleasant a topic when we talk about harm reduction. So what about something a little bit more challenging? Let's say an organization came into town and they proposed opening maybe a needle exchange program, or even a wet shelter in the city. What would your response to that be if you were mayor?
If I was mayor, I think the response would be similar to what I just said, is it's something that I need to do more research on. I've heard the pieces that we hear in the news about these sites, and it's come up in a couple of the conversations that I've had through the Massachusetts Municipal Association when we meet with the Mayor's Association or the Town Administrators Association. But anyone who gets elected mayor with any decision they have to make is going to have to be willing to listen and to work with people. And it's just a topic that I will admittedly say I just don't know that much about, other than what you hear on the news, which, again, we know that there's a stigma out there. We know that there's misinformation out there. If someone wanted to come in and open those shops, I would say I would have initial hesitations because, as I said, that's all the information that I've been heard of so far. But that by no means means I'm not willing to sit down and talk with them to see what best solution we could come up with our community in the end.
Okay, great. Thank you. And help me out, Alexa. We're going to Scott Cordero, right? Okay. Scott, same question to you. So if someone approached the city and they wanted to open a needle exchange or open a wet shelter in the city, what would be your response to that?
I feel that some of these things kind of already around here. The needle exchange program is actually run by very good professionals that understand that it's a positive thing. It's not negative at all. But again, you have to walk down the shoes to think that way. A lot of people are against negativity, as far as the programs. But in order to see these programs, I have to agree with Mike that I would need some more information. I do feel that without the program, I keep on talking about Pathway, but without the Pathway program, I want to be where I am today. And so I think that some of these programs are desperately needed in order for people to reach out to them. Without them, there's a lot of people that would still be out there. Thank you.
Great, thanks. And Councilor Graves, to you, same question. Needle exchange, wet shelter. Is there a place for things like that in our city?
Yeah, thanks. I'm with Mr. Nicholson and Mr. Cordero on this one thing, and that is I'm open and receptive to any idea. But I need to sit down and look at it. I'm a guy that does, I know it pisses people off, but I do research, I do homework. I look at things till you can't look at it anymore. So I would be receptive to that. But I don't, of course, just like any plan, you'd have to sit down and look at it. It'd have to be in the right location. Yeah, the public would have to have an input. You'd probably have to have some kind of public input on it, whether it's a task force or a roundtable, because right away there is that negative stigma for anything like that coming into the city. Generally, as far as I know, the public wouldn't want that right off the bat. So it'd have to be something that would be a hard sell. You'd have to really have some. You'd have to have a good business plan for it. And have to be the right location and zoning and all that stuff. But I'd be receptive to anything. I don't say no. My door's wide open. Any idea you have, even if it sounds like a bad idea, bring it to me. I'll look at it. Thank you.
Great, thank you very much. These are hard questions. These are hard questions that are going to face the next mayor for sure, but they're important ones to the community. So I appreciate everyone's open-mindedness. And real quick, Mike mentioned the post-overdose follow-up team. I just want to say, you mentioned with the pandemic, what are we doing? I just want to follow up. Alyssa's Place is actually going to be distributing kind of what we're calling quarantine care kits very shortly that are going to include things like Narcan and harm reduction type items. So if anyone is in need of that, please contact Alyssa's Place through Facebook or by calling, and we will make arrangements to drop one of those on your front steps. And there's a number of kind of goodie items in there to keep people busy and give them something to do during the quarantine. So I just wanted to bring that up. We're going to shift focus here over to more the treatment side. So we've talked about prevention, we've talked about active use, and now we're going to talk a little bit about treatment. And the first question is going to go to Scott Cordero. And Scott, I just want to know, are you familiar with the treatment options that exist in our city? And do you feel like they're adequate, or do you feel like there are gaps that need to be filled from providers or the city itself?
I do think we are, again, lucky to have some of the programs that we have here. I remember years ago, Pathway wasn't looked at as, well welcomed in the city, and now it's got a great reputation. It's got people look up to the Pathway people. because it's long-term. The people that are coming out of there are going on to long-term recovery. Numbers are some of the best numbers in the state. So I think that that's really good. Also, I think there, like I said before, the programs that are out there, well, AA, they're also great. You know, there's a lot of people, you wouldn't even believe some of the people that are, you might talk to on a daily basis and you have no idea they're in recovery. You know, I remember going to the meetings of Recovery Centers of America, and they were trying to open, and people were just like, you know, talking about people that they had no idea who they were, but, you know, they looked at them like they were losers because they were in recovery, you know, and I had to stand up and finally say something. And I said, would you consider me to be, you know, in recovery, you know, and I went on to, you know, protect the people that is near and dear to me, and that's people in recovery. So people don't know, they don't understand, you know, until you actually sit down. There's people in the public office right now that are in long-term recovery, you know, so the people that actually put their lives together and do some great things once they get rid of the drugs, once they get rid of that, you know, initial thinking that there's no other options, and there's plenty of options out there. And it's getting brought up every single day is in my life. You know, I talk to people, you know, in my business all the time about recovery, you know, and it's a stigma-free zone. It's not bad people. Stigma-free is the way to go. Thank you.
Sorry about that. Councilor Graves, are you familiar with what treatment options are available in the city, and do you feel like they're adequate, or do you think there's some missing pieces we need to fill in?
Well, if the questions are asked in such a way as to what the city itself would do, I don't think you're asking that. I think you're asking what's in the community. And as far as I know, the way I understand it is treatment and recovery is pretty much goes hand in hand. I think it's the same thing. I mean, whether it's you know, Suboxone or Vivitrol or whatever it is that people are taking, or methadone, whatever it is that people are taking to recover, whether it's coming off the opioids or heroin or I guess the new one is Valium. We have places like, again, we have Gaamha, Pathway House, and and there's I think Gaamha has 4 permanent treatment homes. I think there's 3 for men and 1 for women, as far as I know. So we have that in the community. But and from what I understand, what I guess the new buzzword is the medication assisted treatment, the MAT. That goes along with behavioral counseling or behavioral therapy. And people are starting to get that at the emergency rooms. So they go to the emergency room either ODing or very sick. And I guess, so when we have a great emergency room here in Gardner, and I think that's where they're trying to get people right off the bat to get into a MAT type program. And I would like to see, and I'm not really sure if the city can connect with the hospital or the emergency room to do that, but to get these people sort of on the ground floor, I think, at the emergency room, I think that would that's the time to get them on these MAT treatments. Thank you.
Thank you. And Mike, to you, are you familiar with what we have available, and do you think there are gaps we need to fill?
Yes to both those answers, the quick, but yes to both of those questions is the quick answer. When I was working in Mayor Hawk's office, and then when I did my internships with Senator Flanagan, Senator Brewer, and Governor Baker, this is a topic that came up all the time for us in Central Mass. Prior to the Quabbin Retreat and Recovery Centers of America being opened in our region, we really, we used to refer to us as the treatment desert. People were sending their loved ones off to treatment centers off in Timbuktu just to find help for them. And that's not something that we should be doing. As my other 2 colleagues have said, there's a stigma that just needs to help be broken. And that's how we help increase our treatment here. If you see someone on the side of the road who fell off their bike and broke their leg, you don't you don't turn your face and walk the other way in disgust. You go out and you help them. We need to start treating those who are suffering with the disease of addiction as a person suffering with the disease of addiction. There's a human person with a human heart and a human family behind that face that's there. And once you get that there, you start realizing the importance of these treatment places. Now we have the Quabbin Retreat run through Haywood Hospital, the Dana Daly Center, the Dana Day Treatment Center, where people can go to if they're experiencing these problems. The Angels program that I talked about in Gloucester, it's if you need help finding those things, you just reach out to someone. I was speaking to one of our local business owners the other day who said she randomly got a call from someone who was like, I saw what you and your family have gone through. I can't find where to go. Where do I go to find my treatment? And we use that built-in network that we have here. I think one of the ways we can bridge that gap is having a community awareness roundtable of the treatment options that are there. That way we're working with our business owners, our community leaders, our stakeholders, and Gaamha, AED, GCAT to make sure just everyone's on the same page that's out there, because if we spread the word of mouth among our own networks, that's how we can really help see what treatment options are out there and see where we need to start picking up where we're really slacking in that area. Thank you.
I'll figure that out eventually. The next question is it's an audience submitted question. And the question is, and this is to Councilor Graves, what is your opinion on the connection of substance abuse or substance use and domestic violence and addictions for both victims and perpetrators of domestic violence?
Could you ask that again?
Sure. What is your opinion about the connection of substance abuse and domestic violence?
Well, I think a lot of domestic, again, I'm ignorant. I'm just talking from what I know, paying attention as a human, reading, doing research, being in the community. I think a lot of domestic abuse is happening when people are on some substance, whether it's alcohol or a drug. I think most people aren't violent humans. When they get too drunk, or if they get on drugs, that's where the domestic violence comes in. So, as far as I'm concerned, that's 100% probably the biggest cause. Again, I'm no expert, but I would say that's probably the biggest cause of domestic violence, and that needs to be addressed 100%. And I mean, I know the police every day. The police department every day have to deal with them. They call them domestics. Most of their calls are domestics, and it's somebody that, from what I understand, I'm not a police officer, but from talking to my neighbors, a police officer, and I know some police officers, you go and these people are just high on something, mostly booze, and so I don't think it takes a rocket scientist to put two and two together. Where there's a lot of booze abuse and a lot of drugs being done, there's going to be domestic violence. So that's a problem as far as I'm concerned. Thank you.
Thank you. And Mike Nicholson, same question to you. What do you think about the connection between substance abuse and domestic violence?
I think there's a lot of connections there. I'm going to start off by saying that when the current pandemic situation started, the first day that we entered into the current stay-at-home advisory that the governor put in place and the closure of essential businesses, that afternoon I had my police chief and my fire chief, who runs our ambulance service in Rutland, in my office. And first thing I said to them is, how is this going to affect our domestic violence cases now that people are home and don't have as much of an escape to go to? And how is this going to affect the calls that we have in terms of our overdose and drug use calls? And it's a conversation that we need to have, and it doesn't just happen when we have this pandemic. It's something that we need to have a continued conversation with. Councilor Graves is right. One of the ways that could lead to domestic violence is if someone is not sober and is having an episode that way. But it's also could be related to someone who's trying to find that escape if they themselves are being abused too. And they may be using drugs and alcohol as a way to get their mind off of the abuse that they're going to. I think that adding that type of awareness to our prevention practices and just actions that we're going through is something that you need to keep hand in hand. One of the things that when I was working in Senator Flanagan's office that we were talking about was meeting with the area business associations and chambers of commerce if you were to go in public bathrooms, sometimes you'll see posters that say, if you are a victim of domestic violence, please call this number. Putting up a poster next to that that says, if you are suffering from addiction or you need help, please call this number too, because the problems just are so interconnected and interwoven to each other. Can they happen separately of each other? Of course they can. But is there a high chance that there'll be a vulnerable person because of those instances? Yes, I think so. Sorry.
I'm sorry.
No problem. I was just going to say, I think that so long as we maintain that connection in our mind as we have these discussions with our stakeholders, that's how we get through that.
Great, thank you. And Scott Cordero, a question to you. What do you think about the connection between substance abuse and domestic violence?
I definitely agree with both of the candidates. But I will say that, as the pandemic started, I was talking to some police officers, and then the domestic abuse just rose like a lot. I don't want to say a certain percentage because I don't want to be wrong, but I also think that some of these circumstances are related to drugs and alcohol and are not related to drugs and alcohol. So with that being said, I would like as far as a volunteer staff, as I was talking about earlier, to get put on there as some professionals in that staff, or volunteer staff, as I would call it, to be able to reach out. And they need to be connected to counseling, whether it be single counseling or, group counseling, relationship, whatever but I think it needs to start from within. As far as drugs and alcohol are concerned with domestic, there's definitely no doubt in my mind that it's definitely connected to that. But you have to have counseling afterwards. You just can't say, okay, the fight's over, okay, you're sober now, and everything's going to be okay, because it's not going to be okay. You're going to need help. You're going to need help, stigma-free kind of help, where people are not going to look at you as you're a bad person because you push somebody or you argue with somebody or you threw something across the room, whatever the case may be. But it has to start from within, has to start from the person. Thank you.
Great. Thanks, Scott. Our next question is going to go to Mike Nicholson. And we heard a little bit earlier, Councilor Graves mentioned MAT, or medication-assisted treatment. And the question for you is, what are your thoughts on medication-assisted treatment? And hypothetically speaking, if an organization were to come into the city and wanted to open a methadone clinic, do you think there's room for that in our city? Do you think it's appropriate? And how would you feel as mayor if you were posed with that situation?
I feel like I'd say the same answer that I said when we talked about the wet bed shelters and the needle exchange earlier. The information that I have is very limited, and it's a discussion that if someone wants to come in and they think it'll help, we'll sit down and have the discussion. It is something that, again, because just I have very limited information beforehand, that I'd be hesitant to just say yes off the bat until we have that discussion to see, does it fit in our community? Is this something we should be looking at as a regional collaborative with the Tri-City area with Gardner, Fitchburg, Leominster? Is it something that hurts more than it helps? Is it something that we have the resources already in place to sustain and make it sustainable, that if it happens, we are able to go forward with it and make sure that it is something that lasts here? So it's a discussion that I'm willing to have. I'm always willing to sit down and talk to someone without just saying an outright yes or no. But again, it's something that I will admit I just need more information on.
Great, thank you. And then Scott Cordero, your feeling on if someone were to approach the city and wanted to open a methadone clinic, what would be your feelings?
Well, I know of one doctor that offhand that a family member was getting some help on that. So I think if I'm correct, I believe that's still available. And I don't want to say names because I'm not sure of the name, to be totally honest with you. But so I think that some of that help is already here. As far as a methadone clinic like Fitchburg has to come out here, I would have to see the details, the location. I have to have some more input on that. I'm not against any type of recovery. Myself, when I came up here, like I said, 26 years ago, I went to Pathway. It was a working house. There was no, I'm going to give you a pill and things are going to get better. You had to work hard. You had to go through the steps. You had to, do what you needed to do to be a human being and to get back into society. Things have changed. Things have changed since I've come up here, and there's a lot more outlets. And I think that whatever can help, I think that I'm all for. But I would have to know a lot more details. Who's going to pay for it? Where it's going to be? What kind of counseling they're going to do with it and after it? It's not just take a pill and things are going to get better. I just don't believe in that, and that's my personal belief. But thank you.
Thanks, Scott. And Mr. Graves, to you, the question: if confronted with the idea someone opened a methadone clinic in the city, how would you feel?
Yeah. Again, it is, as Mr. Nicholson said, it's similar to the needle exchange question, but I'd like to maybe step back from my prior answer, and that is the mayor is not king in Gardner. We have a city council, and basically nothing happens without the city council anyway. So I think the question is, and also we have a thing called the United States Constitution and the Massachusetts Declaration of Rights. So businesses get to do what they want. In other words, they get to exercise their rights. So the mayor can't say yes or no typically on something like that. But my attitude would be the same. If zoning allows it, the business plan, the planning board okays it. If the idea is good, the mayor can't just say, nope, you're not coming here because we don't want a methadone clinic. I mean, there's rules and regulations and constitutional rights involved, but it's not a good thing for the city to have. Nobody wants a methadone. Let's not be coy about it. Nobody wants a methadone clinic here, but if there's a need for it and it's done the right way, I'm receptive to it. Thank you.
Thank you. Real quick, just a little note. I'm understanding we're having some trouble with the live stream on Facebook. Know that we're recording this and we will post this online when the event's over. Next question is going to go to Scott Cordero. We're going to move our way into the recovery portion of our questions. And this is another audience submitted question from Sue Avalone, a member of the board of directors for the AED Foundation, and I believe a member of the Board of Health as well. Sue wants to know, how would you as mayor plan to support the recovery community in Gardner, and what additional work could your office assist with as it relates to the work being done by the AED Foundation and others to defeat the stigmas surrounding addiction and recovery?
I think just with my past experience, I can kind of speak from my heart about this. People in recovery still want to have fun, and that's, we work very hard to keep our addiction at bay. And we work very hard to better our lives and not be judged, because when we're out there, we're judged a lot. But I feel, when I first got sober, I was very active in the AA community. And we did a lot of dances. We did a lot of campouts. We did a lot of, fun things, Sober in the Sun, Half Moon Festival. We did a lot of great things. And there's great things going on all the time, in recovery. And you don't have to be high or you don't have to be drunk in order to have fun. And I have fun all the time, and I still act a little crazy, but, I've been sober for quite some time. But I think that, we need to open our doors as far as the city is concerned to be able to have these events and to show people that we are human. We are just like you, just like anybody else. Just because we have a sickness, it goes along with anything else. But I think, matter of fact, me and a couple of friends, we used to have sober New Year's Eve dances at City Hall in the auditorium. We used to rent out City Hall. We hired a policeman. We hired the janitor. We hired a DJ. We had it catered. And this was right at City Hall. So there's a lot of things that we could do as a community, but we need to open our hearts and open our minds and not judge. Thank you.
Thank you. And same question to Mr. Graves. how would you support the work being done by AED Foundation and others to help defeat the stigma around addiction and recovery?
Yeah, I don't know. I don't I don't look at people in recovery with a stigma. Maybe I'm different than other people. I don't like, I mean, Mr. Cordero said that maybe people think they're losers or something. I mean, I don't think that at all. But I understand. I think, again, I'm ignorant on this, but I think the stigma is not as bad as it used to be, because I mean, you got the cartoon image of the guy with needle, like, you know, some hippie with a needle in his arm on the side of the road in the 60s. I mean, these are people, a lot of these people got addicted from prescription drugs and they just couldn't get off it. It wasn't their fault. The drug companies gave them some bad advertising, sold them a rotten apple, and they can't come off it. It's not their fault. There shouldn't be a stigma, and I think it's getting better. I hope it is. But one of the things I wanted to do as mayor, and I'm going to do if I get elected, is I'm going to have a roundtable for the citizens. Now, people in recovery are humans just like people not in recovery, and these people, I would welcome them to come in and help the government, sit at the roundtable. They just don't know things about recovery. They know things about everything. They've had experiences in their life, not just recovery, not just doing drugs, not just doing alcohol, or whatever it is your problem is, whatever your beast is. You come to the roundtable, we talk about all the things that are going on in the city, how we can make the city better. They can bring their own value to that table. And if their value happens to be in that one part of their life experience where it has to do with addiction, then let's share it. And that takes away the stigma when everybody's talking about it. So that's what I'll do. Thank you.
Great, thanks, Scott. And Mike, same question to you.
I would say that one of the main jobs for the mayor, and myself, if I am lucky enough to be elected, is that you need to be the main advocate for the recovery community here, because those residents who are struggling are the people who you are put in charge of helping to make sure you're their biggest cheerleader. I think working with the AED Foundation, Gaamha, GCAT, the organizations that we have, to either help with the grant writing that goes on. I know AED just got a massive grant from the federal government, which is fantastic to hear about. But what else is out there? And how can we help look for those? And how can we help get those grants? I mentioned the prevention coordinator in my earlier answers. There's no reason that someone working in prevention also doesn't help work on treatment and work in the bookends of the system that's there. I think promoting the fact that we have a peer recovery center downtown is something that the city should be doing to help our recovery community. Those peer coaches that we have who meet with those that are struggling and trying to recover save lives every day that they meet with someone. And that's something that we really shouldn't forget about or understate. We do well partnering with these organizations. We have the International Overdose Awareness Night, where we not only remember those who have lost their struggle to addiction, but we also use it as a way to build hope for those who are struggling. I mean, even if you look at how AED started, it started with a personal tragedy that now works to help save lives every day and works as an avenue of hope. Just because I know you said Sue Avalon as the one who submitted this question, and I saw I have 30 seconds left, I just would be remiss if I also didn't thank Sue. I know she's one of our 3 nurses helping work with all of those who are struggling with the COVID-19 pandemic and those who have been diagnosed with that. So I just want to thank her. I know she submitted that question, and I'd be remiss if I didn't say that because I had a family member whom she helped. So thank you very much, Sue.
Great, thanks, Mike. Next question is going to be Councilor Graves is going to start us off. Scott, when individuals are fortunate enough to either through treatment or peer support to establish themselves in recovery, and with an entire generation of young people trying to recover from this opioid epidemic we've mentioned, what can the city do to help these people? One of the things they struggle with the most, or a couple of things, are to find housing and employment opportunities as they're in early recovery. So what could the city do to help promote sober housing opportunities and employment opportunities for people who are in recovery?
Well, I think the first thing we do is support the organizations that we still, even give greater support to the organizations we have here now. Not to sound like a broken record, Gaamha is huge. I mean, thank God we have Gaamha around here. I mean, and Gaamha's been, and thank God for you, Sean. And everybody knows it. And we have, in Alyssa's place is a great thing to have. And we have it downtown. I mean, some people would say, well, we should have stores downtown or things like that. And I know there's the coffee shop or the cafe that we've been talking about then. I think, isn't it going to open up? I mean, I think it still might happen. But at any rate, we have that within walking distance for most people that need services. And we have the Mart bus. But I think we should, I would be willing to give even more support than we do. Now, we just voted on a community development block grant to give, I think it was Alyssa's place, or it might have been Gaamha, $6,000. I think it was Alyssa's place, $6,000. And I think that was CDBG money, and the non-matching funds were another 6 or 7. It was like $13,000 in all. It's things like that. That's an investment that the city makes to have a healthier community and to help people. And I think that fosters the whole thing that I was talking about on the last question, the whole thing with, it takes away the stigma, and it gives more like a team type atmosphere where everybody's pulling for everybody else, and it becomes a symbiotic relationship. And so from the city standpoint, I would be supporting the organizations that are still here and being wide open to the ones that want to come in. Thank you.
And Mike, same question to you. What can the city do to help promote sober housing opportunities and employment opportunities for people who are in recovery?
Well, I think I'd go back to the answer that I said earlier on about having a roundtable discussion with our business owners at Chamber of Commerce, Gardner Square 2, and for terms of employment opportunities, and have Gaamha, AED, and those organizations at the table at that discussion. I think if there's one thing that I've said multiple times, and I'm not afraid to say it, is I'm no expert in this discussion. Nor have I personally been affected in my own life by drug abuse and addiction. But I know that those at Gaamha and AED have this and have their boots on the ground day in and day out every day with these topics. And having those discussions so that our business owners really know the needs of those that are in recovery, the skill sets that they have, that this really is everyone. They aren't scum on the street. They're real people that actually have skills and knowledge and are a viable resource that we're just underutilizing right now. And I think having that discussion held through the city and the Chamber of Commerce or Gardner Square 2 or other organizations helps build that there. In terms of supporting sober housing, I feel like it's the same type of discussion in that if I'm elected mayor, I would sit down with you, Sean, and Michelle from AED and other partners in your networks and say, where are we lacking and what do we need? Are there certain areas of the city that we are struggling with in this area? Do we have enough? Where could we go? Is this something we could partner with other communities if we don't have the space available for it? And how do we get that word out there once we do have it there? And I think that's just a discussion that we need to have with each other.
Great, thanks, Mike. Scott Cordero, to you, what can the city do to help promote sober housing and employment opportunities for people in recovery?
I'll say that going back to my early recovery, I know when I went to Pathway House that, it was a working house. You had to have a job. That's plain and simple, and it had to be a full-time job. But what I would definitely like to see, and I've been thinking about this for a while, is kind of like what Monty Tech does, like a night program, but a night program for adults, kind of like bridging the gap in, help people in recovery, not just people in recovery, but anybody that wants to better their lives, go in and learn some kind of job. The electrical, the plumbers, Massachusetts, as far as trades, as they're hurting. The trades occupation are hurting. And I think if we could teach the people in recovery this job and have a job placement program, you could take out a student loan now, because the city can't fund the whole bill, that's for sure. So, and then once you start working, you can pay that student loan back, just like, a college would be, but I think a trades person, hands-on, learning a new job, getting back out there into the work field, these people can now make good money, support their families, maybe buy homes, buy cars, maybe stay in the community like I have. I had to go back to school in my recovery to learn a new trade, and I did, and I'm still in it. But I think that's one of the things this city is lacking is an educational program like that. As far as housing, Gaamha owns, there are a lot of landlords that have places that are open to people in recovery already, so I think that Gardner is doing a pretty good job at that right now. Can always be room for improvement. There's always room for improvement in any particular topic. Thank you.
Thanks, Scott. We're going to move on to a couple of listener or viewer submitted questions. And I just want to say, we appreciate the accolades that the three of you have given to Gaamha and AED, but I want to say we couldn't do this alone. This community is filled with great providers. We have obviously Haywood Hospital, Haywood Healthcare, CSO does great work, and Luck is involved in the city. So there's a lot of great providers. We're very lucky to have them all. This question is going to go to, I believe Mike is up next. Mike, what is your opinion on the government's determination, the state government's determination of liquor stores and pot shops as being essential businesses during the COVID pandemic?
I'll admit that I kind of jumped back at first when I saw that because it's just not what I thought of originally. But when you think of those that are in withdrawals and need it for medicinal need marijuana products for medicinal purposes, I can understand why Governor Baker chose to make sure that those struggling weren't also putting themselves in harm's way. Through that, well, again, as I said earlier, at first I was a little surprised by it. But however, in speaking with people whom I know who are going through these struggles, it granted me just a different perspective. It's you hope someone doesn't resort to going back to using those substances, but you also don't want to harm them at the end. It's part of the whole harm reduction topic that I think we addressed earlier there is you don't want someone doing something worse than what's available there. But I will admit, I did have my second thoughts when it first came out.
Okay, good. And Mr. Cordero, same question to you. What are your thoughts on liquor stores and marijuana dispensaries being deemed as essential businesses?
I'll admit that I did have my I wasn't too happy with it at first, to be totally honest with you. And then someone they called me out on it and told me to remember. And so I had to take a step back. And you didn't want them in the hospitals, using the hospitals as a detox, because the hospitals already had their limits. And it was due to people in recovery that made me realize that I was wrong. And I'll admit when I'm wrong. It's simple as that, and that's what kind of makes me understand a lot of things easier. I don't have to be right all the time. I can be wrong too, and that's fine. But as far as the marijuana, for me, it was a gateway. It led me out to bigger things. But as far as the medical, I think there's a lot of studies that have been done as far as the medical aspect of it, and if it's being used for medical, then I understand, because the pharmacies were open. But as far as the liquor stores open, yeah, I was kind of against that, to be totally honest, and because my business was shut down. So maybe it was because it was a personal attack, as far as my business was shut down, and maybe I took it a little too personally. I'm not sure, to be totally honest. But thanks to my friends in recovery that kind of brought me back and humbled me a little bit and told me to remember when. So to them, I appreciate it. Thank you.
Thanks, Scott. And Councilor Graves, same thing to you. What are your thoughts on those businesses being deemed as essential by the state?
Yeah, I don't know if we're getting hung up on a label, and that label would be essential. I don't get hung up on labels, so I looked at it this way. I'm not a big fan of Big Brother government, first of all. So I look at it this way. What do humans consume? What is it legal for humans to consume? Food, liquids, alcohol, marijuana. So I know what Mr. Cordero is saying, like his business was shut down. Why not the liquor store down the street? Because you can't eat a haircut, or you can't drink a haircut. So it kind of made sense to me. plus, for somebody who was on a liquid diet, preferably vodka for about 30 years, you don't want to be stuck at home with no booze. So, I mean, people have a couple glasses of wine with their meal, and it gives you some, I don't know, is the question that we're creating drinkers or potheads out of people? I just think, I don't think that people are saying that. So I don't think it was a big deal. If they said, okay, so you can open liquor stores, the pot shops, and barber shops, I'd have a problem with that. But otherwise, I don't have a problem with it. Thanks. All right, Mr. Cordero, nothing against you, but you know what I mean?
Got it. Thank you. All right, we have another viewer submitted question, and Scott Cordero, you're going to start us off with this one. And you touched on this a little bit earlier. The question is from Margaret Bissonette. Do you think that the development of a trade education school or program would help with giving people in recovery a sense of hope and purpose that's currently no longer available in our area? Monty Tech used to serve this purpose, does no longer have this for those most in need.
I absolutely guarantee that it would help. Monty Tech has a night program, like I said. Unfortunately, a lot of people in early recovery don't have transportation, and some of the MARC transportation isn't available at night, to get to a program down there, so it leaves us here in Gardner kind of not being able to better ourselves as far as a job. The jobs around here are very limited, but I think, like I said, I would let, we're talking about a new elementary school. Well, if we do this new elementary school, what are we going to do with the old schools? Is it going to be another empty building? That is definitely not what Gardner needs. I would like to see one of these schools that are going to be being empty used as a trade school. I think teaching people trades. When I was young, you went to a trade, a vocational school to learn a trade, and you came out and you had a job. There was no waiting. I think that this town could definitely benefit from a trade school. Not only with people in recovery, but people in general. The jobs around here are not too well, paying as far as what people are making. It's tough to support a family. It's tough to better their lives, So I think with the trades, it's a lot more money involved with the trade, but you got to learn the job, And I think that this we could take one of these empty schools and definitely make it a trade school, and it'd be a great program for Gardner in general. Thank you.
Councilor Gray, same question to you. What are your thoughts on development of a job program or a trade school to help people in recovery in the area?
Obviously, it'd be great. I mean, it'd be a welcome benefit to the whole community to have something like that. But it's not possible from the city level. I mean, it's literally impossible. You'd need, but you could put together a public-private enterprise, a public-private partnership. You'd have to have a private investment group that would come in with a business plan to do something like that, or the Commonwealth of Massachusetts could do something. But these days, if you're west of 495, you kind of don't exist in Massachusetts. You're just there to pay taxes. Beacon Hill doesn't really know we're out here. So I don't see it happening, but again, it would be wonderful. And I think Mr. Cordero said it, not just for people in recovery or people looking to get back on their feet, but for everybody. Monty Tech doesn't serve the same purpose as it used to serve when I graduated in 1982. They don't teach trades anymore per se. It's a college prep school. So when I was going to school, and Matt Hawk was he agreed with me 100% on this. I agree with him 100%. He was behind this whole theory, and that is, for somebody who's good with their hands, but maybe not so great at taking tests, and they would want to go into something like woodworking, cabinet making, what have you, welding. Monty Tech was there for these individuals when I was in school, and they went there and they didn't want to go to college, and good for them. But that Monty Tech's not there for that anymore. It's there as a college prep school, and that's a big problem. And they'll say, they have their own story, but I would love to have that in Gardner. If we could put a public-private partnership together, if the Commonwealth of Massachusetts could come down here and see that we do exist, maybe we could put something together, even start at a small level and build up from there. Thank you.
Great, thank you. And Mr. Nicholson, same question to you.
I would say yes, training for the trades is something that would be helpful and the city should promote. While we are not currently allowed under existing state law to open our own trade schools that offer the same trades as Monty Tech, it doesn't mean we can't use the resources that we already have. Mount Wachusett Community College offers several professional development courses, and the hospital acting as a conduit for getting people to those courses. I think Councilor Graves hit it on the head with the way to do it is through a public-private partnership. Working with, again, our organizations like Gaamha and AED, President Vanderhoeven at Mount Wachusett Community College, President Brown at Haywood Healthcare, and Gardner Academy for Learning and Technology. I think finding ways to promote these new educational and training programs with the resources that we already have in place helps. Furthermore, I think Governor Baker's current plan about trade schools in the Commonwealth will also help with this, where he's moving toward the 3-tiered model, where you have the students who are able to get in under the current admissions policy, go to school during the day from your normal 7 to 2 classes, from 2:30 to 7. There's the students who weren't able to get in for the academic part, but are able to get in a trades training program, and then a night program for adults who are also in need of trades education as a way to get back into the workforce. This is something that Governor Baker's administration already announced, and I was able to hear him say it when I was at the State of the State this year, and it's something that we're already on the municipal level in talks with the governor's administration to see how we can implement that to best service those in our community. If we can find a way to connect those with those that are in recovery, to help find them skills to get back into the workforce and help rehabilitate their lives, I think we should take every avenue that we have with the resources that we have and the abilities that we are able to do.
Great. All right, gentlemen, you've been kind, you've shown your creativity, you've been cordial, and I think it should make us all feel that no matter what happens, the outcome of the election, the mayor's office is going to be in great hands. So with that said, starting with Councilor Graves, we're going to give you each 2 minutes to kind of give us your closing thoughts. And to the attendees, I ask you to stay tuned because we're going to draw 4 names. We've got all your names written down. We're going to draw 4 names at the end and give away some gift certificates to some great Gardner restaurants. So with that said, Councilor Graves, give us your closing thoughts.
Yeah, thank you, Sean. Thanks for having us. I know it's been a difficult 2 months with the pandemic. It's been obviously unprecedented. So it's the city has some serious challenges in front of it. The economic consequences of the shutdown are going to be severe in Gardner, and it's a community like Gardner, where we're more of a blue collar type area, and we rely on those small retail jobs and the small businesses and the retail type jobs, not just in Gardner, but the people who live in Gardner work in, within 30 miles from here. So we have a lot of the consequences of this shutdown. I've said it before, it's going to last 12, 18, 24 months, maybe even longer. So the city has to be ready for that. I will be ready for that if I'm elected mayor. I just want to say that my door is going to be open to everybody, anybody that has any ideas, bring them to me. I'm wide open. I love ideas. We can talk about it. But I see a bright future for Gardner, for our children. It's not going to happen right away, but we can get that thing going. We can get the ball rolling down the hill. And there's no better time to start. Thank you, everybody.
Thank you, Scott. Mike Nicholson, to you, your closing thoughts.
Yes, I'd just like to say thank you to GCAT, Gaamha, and the AED Foundation for sponsoring this evening's events and allowing us to share our ideas with you all. This election cycle has been nothing close to normal, and neither will things be close to normal for the first couple months that the new mayor is in office. But I think that one thing that comes out as a common theme from this whole pandemic that we've seen is the theme that we are all in this together. And this is something that's not unique to this time either. Whenever tragedies have happened here in Gardner or some issues have come up, the community always comes together to support those that are down and help bring them back up, and we end up stronger in the end as a result. Gardner's miles ahead than some other communities when you start talking to other mayors and municipal managers across the state in its recovery efforts. And that's thanks to the work of organizations like Gaamha, AED, and GCAT that are just working constantly to make sure that those that are in need have the help that they deserve. And I think if there's one thing that I at least hope people take away from tonight is that the community is behind those that are struggling. If you need help, reach out for help because your community is here behind you. And also with that, if you are able to help, please do because your community needs you too. It's a reciprocal relationship that we have just with our neighbors here. But overall, I'd like to thank you all for your time tonight, and I'd like to respectfully ask for your vote in the upcoming elections on June 2nd and June 30th. God bless you all for all the work that you do every day here, because every day you're working little miracles here in our city, and I personally cannot thank you enough for that. Thank you.
Thank you, Mike. I don't know. Okay. I think we got Scott back, I think. Okay. All right. Scott, you there?
I am.
All right. Good timing. You got 2 minutes to give us your closing thoughts.
Thank you, everybody, and I appreciate everybody's time. I like to say that, I am a proud resident of Garden now, and this town has been greatly impacted my life, not only with the people in recovery, with the people in general, and I feel like it's my time to give back. I have some good ideas. I think there's some great people in this community that like to see some action. Unfortunately, it does not happen overnight, and we have to have some funds in order to do that. It takes time, but I think with the open door policy and the transparency in our local city hall and our government in general is definitely what we need. There's some things I would like to see change in this community. There's a lot of things I could say, but I won't get into because I'm limited on time. I'm sure the other candidates can feel the same way, but I think business has to come back to our community. When I came here, there was a lot more businesses, and we need to open our doors to that. And as far as bringing businesses, community, the incubator is doing a great job up there. But Rome wasn't built in a day. But I think the strength that this city has, I can say, some of the people, when there's maybe somebody dying of cancer, and the people in this community really get together and they really lift some people. I've never seen that before in any community. But I think that this city has some great strength when we come together, and I think that we can do this. There's no such thing as I, but there is such a thing as we. And I thank you for your time.
Thank you, Scott. I want to remind everybody some really important dates coming up. Voter registration deadline, from what I understand, is May 22nd. So please, if you're in the recovery community or not, all those guys at Pathway House, if you're watching, get down there, get online, register to vote so you can be a part of this process. We have a preliminary, I think they call it a primary or preliminary election coming up on June 2nd, where this field will get kind of narrowed down. Did you want to get something? Oh, I thought Scott was motioning something to me. June 2nd, that will be where the field will get narrowed down. And then I think as of right now, the general election is slated for June 30th. I understand that was pushed back a little bit more, but June 30th right now is the target date for general election. So you're a part of this community. If you want to have some say in how it goes, get out there and vote. That's how you'll do it, at the ballot box. With that said, Veronica, I don't know if we can unmute you. Oh, you're there.
I'm here.
All right. Welcome, Veronica.
I also have a very scientific way to picking the winners.
Good. No, we're all about the science here.
So please stay on so we can get your mailing information if you're one of the winners. So the first one is Josh C. Second one is Ann Hurst. Margaret Bissonette. I don't know. Sorry, I'm really bad at pronouncing names. And then last one is, there's a lot, just last name Belcher. So if you're one of the winners, please stay on after we're done here, and we just collect your information. And I just want to say thank you to all the candidates. You all did a great job. And thank you to Sean and Alexa for managing all that.
Great. Thank you, everyone. Again, this was brought to you by Alyssa's Place Peer Recovery and Resource Center, by the Gardner Community Action Team. And we thank you all for your time, and have a wonderful night. Thanks.